is hosted by the Pennsylvania Commission for Women. As parents, grandparents, and guardians, our primary focus is to keep our children healthy and safe. So with Monday's FDA authorization of the Pfizer vaccine for children between the ages of 12 and 15, we all think that it's more important than ever before that all of us have answers, to questions that we all have, and to have the answers from professionals. COVID-19 vaccines are new, and it is absolutely normal to have questions about them, especially as it comes to for each of our children and grandchildren. There is so much information that's around, and there is so much misinformation, and it's all overwhelming. And it's hard to figure it out on our own. So we thought today we would have a panel of professionals to help us and guide us through the path, the safe path for our children to be vaccinated. So I'm really, really pleased to be joined today by Pennsylvania's Acting Physician General, Dr. Denise Johnson. So, hi there, thank you for coming, as well as a panel of other medical professionals from across the Commonwealth. And they are today Dr. Elena McDonald and Delana Wardlaw, also known as the Twin Sister Docs. Dr. McDonald is a pediatrician and the chief medical officer and the owner of 3 Philadelphia-based outpatient practices. Dr. Wardlaw is a family medical physician with Temple University Physicians. We also have with us Dr. Sylvia Owusu-Ansah. She is the EMS medical director, the assistant professor of pediatrics and emergency medicine, and associate vice chair of diversity, equity, and inclusion at UPMC Children's Hospital in Pittsburgh. Welcome. And finally, but not least, we have Nick Mulhern, Dr. Nick Mulhern, a board-certified pediatrician with Meadville Pediatrics. To each and every one of you, thank you for taking the time out of your very busy day and schedules to be with us today. I can't wait to learn more about the vaccine and what this new authorization means for the children and families of Pennsylvania. It is now my great pleasure to introduce my co-moderator, Pennsylvania's Acting Physician General, and a member of our Women's Commission, Dr. Denise Johnson. Thank you.
Hello, everyone, and thank you so much, Mrs. Wolf. It's my pleasure to be here to help to facilitate this very important conversation. COVID-19 has affected so many people across the United States, but really across the world. And this virus doesn't discriminate. It doesn't care who or how old you are. Everyone can get the virus. Now that the Pfizer vaccine is available for individuals as young as 12, approximately 550,000 more Pennsylvanians will be able to get vaccinated against COVID-19. This puts us one step closer to defeating this virus. So I know that you have a lot of questions about these vaccines and specifically how safe they are for both adults and children, and that's okay. There were no shortcuts in the trials for these vaccines. More than 40,000 people were in each of these trials, and that's more than we usually have. No step was skipped. The reason for the emergency use authorization was because we're in a pandemic and people were dying. The trials showed that the vaccines were safe and they prevented people from getting COVID, and we needed to start using them as soon as possible. 250 million doses have been administered. We have good safety and effectiveness data like we've never had before. And I expect that we'll be getting full FDA approval coming pretty soon. So it's essential that we continue to have conversations like this so that we can dispel any rumors and provide you accurate information, because we know that good information leads to good decisions. I'll turn it back over to you again, Mrs. Wolf.
Thank you so much, Dr. Johnson. I really appreciate that. And I really appreciate the encouraging words that you have. And I'd like to now turn the conversation to each of our panelists and to ask other questions about the vaccine. Dr. McDonald, I'd like to start with you and a question that I think that many people have. how will the vaccine affect our children? For example, what are some of the side effects? As adults, I'm fully vaccinated, and I had a headache, and I felt tired after my second inoculation. So, will children have similar side effects? And if a family has already had COVID, let's say all members, is there a thing as a natural immunity that would be better than the vaccine?
Great questions, Mrs. Wolf. So to answer the first question of what kind of side effects that can we expect in pediatric children, same side effects that we saw in the adults, which is it was very important for us not to assume that children would have the vaccine would be just as safe and effective and have the same side effects as adults. That's why it was very important to have trials including children. And the trials, again, have shown that highly, highly, highly effective the Pfizer vaccine is for children down to 12 years of age. And you can expect the same side effects. You can expect some low-grade fever, you can see some headache, you can see some body aches, you can see some chills, or you may have no side effects at all. However, these side effects are very minimal, and the side effects clearly outweigh the risk of getting COVID-19. To answer the second question, if you have had COVID-19, should you still get the vaccine? Yes, the recommendation is to absolutely get the vaccine because one, while the likelihood of getting COVID again is low, there is still a potential risk that you could contract COVID-19 again. And number two, yes, you will develop natural immunity after getting COVID-19. However, we do not know how long that natural immunity lasts. And second, we know that your immune system has a much robust or a better response to the vaccine versus the natural disease process. So we still recommend if you've had COVID-19 that you still get the vaccine if you're eligible.
Thank you very much. I am impressed with your emphasis on sort of long-term protection against COVID in terms of having the vaccine, and it's not only a more long-term defense, but it is also a stronger defense with the vaccine rather than so-called immunity. So I really appreciate you making those points. Thank you. I think, Dr. Johnson, you have some questions? You're on mute. I'm sorry.
Still have to get used to that, right?
Yeah.
Yes, Dr. Owusu-Ansah, I'd like to ask a question about the federal process. So can you tell us why the vaccine is coming out for children later than for adults? And the safety trials for the children's vaccine, are they different from the adult version?
So both excellent questions, Dr. Johnson. So why are we dealing now with the vaccine trials later in children than we have in adults? Well, most of us who are pediatricians, and those of you who have kids and nephews and nieces and grandchildren, all know that children are what we call a vulnerable population, especially when it comes to research. They are not little adults, and the way their immune system reacts to different pathogens, viruses, germs, is very different from an adult. And I think Dr. McDonald just recently emphasized this. And so we needed to be very cognizant for this particular population as to how we go about the safety measures. And so to be clear, for the adult trials, still very much so the safety measures were in place to select a group of individuals, or what we call a cohort, who voluntarily decided to be a part of the trial, to see how, with a small group of people initially, how the vaccine reacted, and then add that to a larger group. In these specific trials, a little bit over 2,000 children received over 2,000 children in general were part of the study. About half of those received the vaccine and did very well. And so because children aren't little adults and their immune system is young, And because a 12-year-old is not the same as a 22-year-old, we kind of have to take our time and do things differently with children. But even with that, we've actually made significant progress by being able to immunize 12 to 16-year-olds at this period in time. The other question, was it different compared to adults? So for the Moderna trial, they're looking at different dosages, just because if you think about it, if you're dealing with a 6-month-old, it might be different than dealing with a 6-year-old to see what the reactions would be with different doses for different age groups. Other than that, the safety measures are the same. Now, we know with the Pfizer vaccine for the 12 to 16, the amount of immunization given or the dose given is the same as adults. And we have seen that the efficacy has been very similar, or actually even a little bit better. So hopefully that answers the 2 questions regarding the trial.
Great. Thank you so much, Dr. Wusuansa. I think it's really reassuring to know that, we've had so much experience with adults because we've had, tens of millions of vaccines given. And it also was reassuring to know that the trials in the children really showed us the same as what we saw in adults, and no worse effects for the children. So definitely very reassuring. Thank you for that.
Thank you. I'd like to turn our attention to Dr. Mulhern and to talk about how all of this will interact with our educational system. Will schools require vaccinations? Is that even legal? And why do our children need to get the vaccine if their teachers, for example, are already vaccinated?
Yes, thank you, Mrs. Wolf. So for the first part of that question, will schools or are schools going to require it? We don't yet have the answers for that yet. I think there's a real possibility that could happen. Currently, we are seeing, the news has mentioned that a lot of universities and colleges are starting to think about this coming fall semester. And they've actually made decisions that they are going to require students to receive the COVID vaccine. And the data is there to support that decision. And then when you come back to kind of the 12 to 18-year-old range, we have safety data that supports that those kids can receive the vaccine. And what we're kind of waiting on is that elementary school age child, where we know the studies are in progress, but we don't yet have them published and the results aren't back yet. So once that data is reviewed and it's determined that the vaccine will be safe and effective in that age group, then I do think that it's possible that the vaccine could be required. And when you look at, Pennsylvania requirements for vaccines, they already exist. There are already certain vaccines that are required for students to attend school. So I think when looking at whether the COVID vaccine could be required, I think it will fall similar to those other vaccine preventable diseases. The last part of the question, which kind of asks about why students should get it even if teachers already have it. So it will by having students get the vaccine, it will increase the total number of people vaccinated, which will provide a greater amount of protection for the whole community. The more people that we have vaccinated, the less likely the virus is to transmit, which means the safer that people are, and hopefully the more we can resume more normal activities. By getting students vaccinated, it could allow, if enough students are vaccinated, it could allow them to participate in basketball without wearing a mask, or for a theater person to sing a song without. So it would just allow everyone to be able to enjoy a lot of the activities that had to be put on hold over the course of the last year plus, and get our students back to all the extracurriculars that they've been missing.
Thank you. As you're speaking as a layperson to all of you, it sounds as if that in having our teachers and children vaccinated, that we're creating an academic bubble of safety. The way some families have come, or families have come together to create their social bubble. And it's encouraging to know that we can create these other kinds of bubbles of safety for our children. And I would think that most parents, that is sort of their utmost sort of mandate, their passion, to keep children safe and, to have not just, their colleagues, their peers, but also their teachers as part of that group. It's encouraging. So thank you for really emphasizing that.
Yes, thank you.
Great. I have a question for Dr. Wardlaw. So I know that, how does the COVID vaccine for kids compare with the other vaccines that kids get? Are they same or different? And also, I know that in the news, there's been a lot of talk about boosters. And I know that for a lot of the kids' vaccines, they have to get boosters. Can you speak to just your thoughts on boosters? Are they going to need them?
So to answer the first part of the question, the COVID vaccine, particularly the Pfizer vaccine that we're speaking of today, that is a different type of vaccine in which the vaccine itself has components that is introduced into your muscle. It has instructions that tells your body to make the spike protein, which is the spike protein of the COVID virus. And when your body sees that spike protein without actually seeing the real COVID virus, then it can develop an immune response. And once it develops that immune response, it will be prepared to battle the real COVID if it comes into contact with it. Now, how is that different from traditional vaccines that we've had in place for many years? Traditional vaccines, typically the components of the vaccine, once it's injected into the arm, that is what what causes the immune response to develop. As opposed to messenger RNA, it's giving your body the instructions to make the protein that the body has to develop an antibody to. So two different mechanisms, but to get to the same end result, to produce antibodies so you can have a defense system to be able to defend yourself if you see the real COVID. Now, I want to be clear that these messenger RNA vaccines do not carry any active COVID infection in it. No active COVID infection in it. And to answer the second part of your question, booster doses, and we see that with many childhood vaccines. So booster doses are needed if the immunity to the vaccine isn't lasting as long as we anticipated, and we need to increase that immunity again. Also a booster dose may be needed with the COVID vaccine if the vaccine is no longer proven to be effective against variants. Now, we don't have any data yet that suggests that we are going to need a booster dose definitively to date. But we keep following the science, we keep following the data, and a recommendation will be made if it is determined that the vaccines are no longer having a lasting immunity of what we anticipated. So we need the booster dose to increase immunity again, and or to increase protection against variants.
Great. Thank you so much, Dr. Wardlaw. I'm glad that you answered the question about, the components, number one, causing COVID, because I think that, a lot of people still have the misconception that you can get COVID from the COVID vaccine. So absolutely not. And the COVID vaccine gives your body instructions to make the antibodies, but doesn't alter you in any way. And I think also, a really good point about the fact that our vaccines are very effective right now against COVID. And so that, in terms of booster doses, really have less effectiveness of our vaccines is we don't get enough people vaccinated and the virus keeps circulating, it has more chance to mutate and can mutate into one of these variants that is not covered by our vaccine or some of our other treatments. So, certainly great reasons to get vaccinated and get more people vaccinated, but thank you for covering those points.
That's great. Thank you, Dr. Johnson. I'd like to just add that from being a non-scientist, non-medical person, I am in awe of the work that all of you do, and I'm also in awe when you talk about following the science. And in following the science, we are just over a year of when COVID came to Pennsylvania, came to America, came to Pennsylvania, or when we just, became aware of it. And in 1 year and a bit, we went from knowing nothing to listening to all of you today talking about the composition of COVID, talking about the composition of the vaccine, talking about the possible prevalence of the variants, talking about dosages for children, talking about side effects for children. We have come, the scientific community, following the science, has come an incredible long way in 1 year. And I am impressed. I can only imagine how hard and long and deep the scientists in our world have worked to get us to this point of safety. And I don't know whether how we, as in a way, recipients of your largesse, scientific largesse, can ever thank you for the work that you've done, for the attention, the care, and your doggedness to keep at it as scientists. That this is imperative. That each of us is our own person, community, neighborhood, but all together as sort of the larger sort of Pennsylvania community. It is incumbent upon us as good citizens to band together in keeping safe. And I am just so impressed by what science has done for us. And in only just over a year, it's mind-boggling, and we don't give it enough attention. So I'm just doing my small effort here to say thank you, and thank you to you all for the work that you're engaged in, and for those who you follow in their research, so you can be the best informed physician that you can possibly be for your patients. So thank you so much for that. I'd like to start off then, to open the questions to all of you. And these are some questions that some people have submitted, and I'm sure we might have others. And I just want to impress, if we can't get to all the questions that have been submitted, we will still answer the questions, but we will have them online on Facebook and other social media outlets for the state. So everyone's question who submits one will be answered. So thank you. For those of you, or all of us who are parents or guardians, will you vaccinate your own children?
Yes. So my kids are 6 and 4, soon to be 7 and 5. So whenever the data comes out for that age group, I as long as it's shown to be just as safe and just as effective, I plan on vaccinating. Yes.
Wonderful.
I have a 16-year-old, and he received his first Pfizer vaccine 2 weeks ago. And I have a 14-year-old, and he just learned this week that he's now up to get his vaccine. So I was ecstatic when I learned that the vaccine, in his age group, both their age groups, and our entire family will be vaccinated fully within the next 5 weeks.
Wonderful. it gives, there's a good sense of relief when that happens, Yeah, very nice.
I too, Ms. Wolf.
I
have a set of twins, and they are 12 years old, and they too will be getting their vaccines as well. And our family also will be fully vaccinated in the next few weeks. So yes, excited that we have vaccines. Vaccines are tried and true processes. It has helped us to get many of diseases under control. So again, our goal is to do this with coronavirus as well.
Well done. Bravo.
I think it's great for parents to really and patients to really hear that their doctors have been vaccinated and they recommend vaccines for their children, because patients really trust their doctors and follow their advice. And so I'm glad that you are able to, articulate that, you feel strongly about these vaccines, strong enough to do that for yourselves and for your children. Thanks.
I too have a 13-year-old who will be vaccinated soon and a 5-year-old. And so both of my kids, I was the second person in the city of Pittsburgh to get vaccinated. So they have watched since December this whole process and have been really pumped and excited about it. So can't encourage folks enough.
Right, absolutely. And I think also it's important that people who work with the public be vaccinated, who have direct contact the way you do, and anyone else, but it's really important. So yes, thank you. This is a question that's also come in. When is it likely, do you think, that the vaccine will be approved for use on smaller children, such as toddlers? And is there anything you could say to parents who are nervous about vaccinating their children with this, COVID is a newer vaccine?
That is a great question. The timeline has always been one of the million-dollar questions in this entire process.
Yeah.
So we do know that current studies are going on in children as young as 6 months of age. So it's just waiting on enough time for the companies to get the appropriate data and significant data that shows that the vaccine is definitely effective and safe as we continue to decrease the age indication. Because again, we can never make assumptions that because it works well in one group, that it will work well in another group. So while we don't have a definitive timeline right now, there's been some discussion about it may be out by the end of the year, but we really can't put a definitive timeline on it. I always say we can't follow the dates. You have to follow the data.
Yeah. And just watching the rollout of who qualifies, who the vaccine is for at different stages, I'm impressed by the care that the different companies are taking in terms of their research. Focusing on adults first, and then a certain age group, and then younger. The assumption, as you say, you can't assume that there's sort of one way for all. And it might ultimately be that in the end, but we don't know that going into this. So I'm impressed with the care that those who produce the vaccines and their research in caring for each age group and making sure that it is appropriate and careful. So, thank you. What is the difference between Moderna and Pfizer? And there's the question that people wonder, is one better than the other?
So I will address that question. So Moderna and Pfizer, they both use the same messenger RNA technology. So essentially, it is two vaccines that use the same path of directing your body to build a defense against coronavirus. The one vaccine, the Pfizer, there is a 3-week interval between the first and second doses because they're both 2 doses. And the Moderna vaccine, there's a 4-week interval between the first and second doses. Similar side, same way in terms of giving instructions to your cells to make the spike protein without seeing COVID. And also, I must say that it does not alter your DNA at all. There has been some questions and concerns about that. Does not alter your DNA at all. It does not alter one's fertility or ability to be able to reproduce. So we just want to make sure that people have accurate information.
Yes, thank you for that. Thank you.
And
Difference?
sorry, to the point of infertility, so for some concrete data during the trials, there were women who actually received the vaccine during the trial and became pregnant afterwards. So just as proof and data that, it does not lead to infertility. That's just additional bit of information.
And,
Another difference between Pfizer and Moderna is 18 and above. Pfizer is 16 and above.
Okay.
I'm sorry, Pfizer is now 12 and above.
Okay, got it. So do we assume that Moderna is also at this point in research to see whether it's good for younger?
Yes. So Moderna right now actively, some of the studies are being led in Yale, started in April, are actively doing trials on the younger folks. So 6 to 12 and then less to 6, like 2 to 6 years old. As low as 6 months as well. And then one logistical aspect of the Moderna Pfizer vaccine is that the Pfizer vaccine needs to be stored at a much, much cooler temperature. So, and if we're talking about the community and means of access, the reason why a lot of times people have to come to the hospital to get Pfizer is that because it can be stored at those really low temperatures, and whereas Moderna, you don't have to store at those low temperatures when you're doing community outreach, you may be more likely to get the Moderna. Not to say that one is better than the other, but that is also one of the other logistical aspects to the two vaccines.
Got it. Since we were, talking of women and pregnancy, what about women who are pregnant? At the beginning, the research hadn't been completed yet. And what is it now for pregnant women? Is it safe for pregnant women to be vaccinated?
Yes, the recommendation is for pregnant women to strongly consider the COVID vaccine. It has been shown to be safe. And COVID has also shown us that its effect on pregnancy can be devastating. And it can cause, preterm labor. It can cause the end of pregnancies, termination of pregnancies. It can cause pregnant women to be hospitalized in the ICU. So the complications of coronavirus on pregnancy is far more significant than potential side effects from the COVID vaccine. And the COVID vaccine we have the data, as Dr. Sylvia previously mentioned, that show that, yes, it is safe. And pregnant women are encouraged to have that conversation with their doctors.
Yes. So
Thank you for weighing in on that. As a former OBGYN, I have to say something, right? But you all are right. The American Congress of Obstetricians and Gynecologists, the American Society for Reproductive Medicine, the Society for Maternal Fetal Medicine, all recommend that pregnant women be offered the vaccine. And I know that there have even been clinics for pregnant women to get the COVID vaccine. So really safe and effective in pregnant women. As Dr. Owusi Ansa mentioned, we do have data not only during the trials, but we have data now from all of the people who have been getting vaccines. New England Journal did a nice comparison. It looked at 35,000 women, and the outcomes of women who got COVID vaccines were not worse than women who did not get a vaccine. So we have a lot of safety data in pregnancy, and so certainly a recommendation.
That's encouraging. Thank you for that. So, to make the point that it's more dangerous to have COVID when you're pregnant, it's more dangerous to have COVID than it is to have a COVID vaccination.
So I would argue that for everything, for everyone, every age group, where you probably may have heard the term long COVID. We are finding out that even patients that had mild to moderate symptoms of COVID are now having long-term side effects of brain fog and memory deficits. We're now putting together neuro institutes for COVID, quote unquote, survivors. We know in the early times, the early part of the pandemic, a lot of folks who survived COVID had such significant lung damage that they're requiring lung transplants. It increases coagulability, which means it can lead to strokes and all kinds of other devastating sequelae. And so when you and for the children, though, I want to be clear, out of 1.5 million children who were positive for COVID at the beginning of the year, only 13,000 required hospitalization. So overall, children are doing well. I do want to state that, but with children, we did witness a sequelae known as MISC, the multi-inflammatory system disease of children, which was children after being positive for COVID, weeks afterwards, presented with this inflammatory disease that looked like Kawasaki's, in some cases looked like shock. Even, we saw few and far between of those children but still that was in response to COVID. So as we were beginning to, and the teenage group was the highest group. So as we were beginning to vaccinate our children, we want to keep all of those things in mind, or these are the kind of diseases, this is the kind of illness, I should say, that we're trying to prevent, and the sequelae to COVID, which there's many aspects of COVID we're still studying, but it is a very detrimental disease.
Yeah.
Absolutely. It's definitely a detrimental disease, one, physically, and we've seen, adults carry that burden of the physical complications, but we've also seen so much taken away from our children as a result of our school systems being shut down.
Yeah.
So we have seen children deal with depression and anxiety. They are just academically, they're not getting the things that they need on Zooms. They are not with their friends. They're not on schedules. They're not getting physical activity, no gym, no recess, and they were forced into that box initially because we were trying to save our entire nation. But now we have a way to get back to a sense of normalcy. You say going to school, everyone being in a class normally, everyone being able to go to the prom, go to the graduation, everyone be able to go on class trips. A vaccine gives us the opportunity to do that again.
Mm-hmm. Yes. Thank you. I mean, for whatever reason, no one wants to see their child in hospital. And we certainly don't want to see our children in hospital for this. So thank you. Someone has asked, can my child go without wearing a mask in school? As well as sports once they're vaccinated?
Yes, I think as long as enough people get vaccinated, I think the protection factor will be there. And that's why we really want to encourage as many people as possible to get vaccinated. Because I think there are a lot of students, a lot of children throughout the whole state that really want to get back to, as Dr. McDonald said, get back to doing all the things that kids have missed doing over the course of the last year plus, for sure.
Great. That's encouraging. So can we just, we've spoken a bit, but just review who is eligible to receive the vaccine now so that we all know, from what age to what age?
Anyone over 12 years of age. As of today, everyone's eligible to get that vaccine.
Perfect.
And so to speak also to the safety profile of this, so we heard the news on Monday that Pfizer had gotten emergency use authorization for the vaccine 12 to 16. But in addition to that, the CDC's committee on immunizations met yesterday, and then based on the data of the trials, further approved that approve the use of the Pfizer vaccine. So that's just to reiterate, because I'm a parent myself, the safety, how the lines of safety that people go through to make sure that our kids will be safe with the vaccine.
Yes.
And the American Academy of Pediatrics have also reviewed it as well, and they've also put their stamp of approval and kind of endorsed that it is safe and effective in the younger age group for sure.
This is so encouraging. Thank you. I'd like to thank each and every one of our panelists for sharing your time and your expertise and your care. Vaccinations for children. Again, we weren't able to address all of the questions that were submitted, but that doesn't mean we were not going to answer them. We will answer them, but they'll be on our social media sites and Facebook and Twitter, please. Log on to those to see other questions and the answers from our panel. Dr. Johnson, I'd like to turn it to you for some final inspirational words.
Well, thank you very much, Mrs. Wolf, and echo everything that you've said. For each one of our panelists, we thank you so much, not only for giving us your time and your expertise today, but for what you're doing every single day, taking care of your patients as well as your communities. I know that if parents have questions or concerns about the vaccine, they could look to their own doctors to get credible information, because we know that when people get good information, they're going to make good decisions. We're in a race now to make sure that Pennsylvanians get vaccinated before we have more of the virus circulating and more emergence of variants. And all of us are ready to get the pandemic in the rear view and get back to the things that we like doing. So thank you all for your efforts to encourage vaccination and for caring for people. And thank you all who have participated in this town hall. We want to provide you the information that you need to go out and get vaccinated, and also to tell your family and friends that you were vaccinated and your decision for doing that. So thank you all. We look forward to more of these conversations.
Absolutely. Thank you very, very much. Take care.